Hello everyone, hope all of you are safe. Happy Sunday, and sorry that my voice is a little bit bad today. Do adjust with that. Thank you so much all of you for joining us on Telegram, and we've had plenty of questions both in the Google forms which we have sent and also in Telegram. So I'm going to take you through a few questions, and these are the most commonly asked questions. I hope it's going to be very useful to you. So let's start with Telegram first, and I have Mrs. Raji. Hello Raji. Her question is, my baby completed 6 full months. Congratulations. I've started with semi-solid since last month. Usually she poops for once or twice a day. In the current week we started apple idli newly this week, and she's pooping 3 to 4 times a day. The poop is normal only, but I'm wondering if pooping a lot is okay, or what should I change in the diet. Okay. I completely understand that, because as a mother, where the baby has had complete breast milk, I presume that the baby was fully breastfed for the first 6 months. When you start semi-solids or solid food initially after you wean off your breastfeeding, it's extremely important that you know that you start new type of food one by one. So as I see here, I think you've started both idli and apple. I presume that you started on the same day or a couple of days later. But one small tip which I want to give the parents when they start babies with semi-solids is that start with one new type of food every day. Give in small quantities first. See how the baby is reacting. The baby is reacting can be seen either the way they are active, because the babies are usually active when they digest the food easily. 2, like how the way of them with their pooping, the number of times they pass motion. So that's also one of the ideas. And also your tummy, the baby's tummy getting bloated. So these are the 3 main ways by which you can see that whether the baby is comfortable with the food it's digested or not, because you're trying new food every day. So another tip which I want to tell you is, if you've started with one new food, give in small quantities, then moderately increase the quantity. What you need to do is, once you start giving new food, space it out, probably 2 days or 3 days, until the baby is accustomed or comfortable with the new food. Say for example, you've started with idli. Start with half an idli first, just to see how the baby is reacting. Then probably next day you can make it 1 idli, and space out your meals. See whether the baby is active. So a 6-month-old baby, probably it's going to be like shaking its leg, it's going to turn around, and all that, the activity can be monitored. Leave 2 days gap and then start your new food, because only then you will be able to understand whether the idli is okay. Then you go through apple, then probably you can mash a few vegetables and give, soft few vegetables and give. So whenever you try new food, you can try, definitely you have to give different flavors to the baby, but then make sure that you space out the amount, the quantity of the food, and also the number of days in between before you start new food. Okay. One more point to add to Raji's question about the number of poops that the baby have in a day. Okay, so basically it doesn't matter as long as the baby is active, and I wouldn't say like there's no complete number of times, as long as the baby is comfortable, and if the poop color and the consistency is okay, 4 to 5 times it's all right, it's completely fine. But then gradually, once the baby's digestive system improves, then it will reduce to 2 to 3 times a day. When you start new type of foods, the digestive system of a newborn baby, or the baby which is growing, this is like neonate which is 6 months old, is going to take time to adjust to the new type of foods. So you can expect the baby to poop 4 to 6 times a day. It's all right, as long as the baby is active, otherwise not crying, and otherwise playing well, active. I think you can be rest assured. Okay. So I hope that answered your question. And hello Priscilla. Priscilla has one question saying, my baby has completed 4 months and 13 days. Excellent. I'm feeding her with breast milk. Very good. But when she's very keen to eat some food, she opens her mouth wide to eat while others eat before her. Is it okay to give any semi-solid food to her? Priscilla, I'm glad that the baby is noticing and you're also having a family time while eating. That's extremely important to bond with the baby. It's very, very good. Yes, until, like, as I'm a gynecologist, and I would pretty much assume my pediatrician colleagues also will agree with me. The first 6 months of baby which is born needs only breast milk, not even water. Okay, the medicines which we give probably are like vitamin syrups or any other mash powders or anything which we give. Other than that, the initial 6 months of the baby, only breast milk will suffice. Why? Because breast milk contains most of the nutrients, almost everything what the baby needs for the initial 6 months of its newborn life. So I understand that the baby's instinct is to open its mouth whenever it sees food. That's how normal babies are, because they're almost into the phase of eating new foods and trying up new foods. But don't hurry up. As long as your baby's digestion is okay, wait until 5 or 6 months, preferably 6 months, and also consult your pediatrician before you take a call, because we would prefer, most of our pediatricians and gynecologists would recommend complete 6 months of exclusive mother's breast milk feeding before you start the babies on soft solids. Yeah, don't hurry up. Talk to your pediatrician about it, have a consult with him or her, and then take it forward or take it slowly. Probably at the end of 5th or 6th month would be ideal time. 3 to 4 months will be little too early to start them on semi-solids.